on any given day, I'm anywhere in the hospital, and I just happen to be walking through the ICU, and a nurse that I know, a young nurse, was in the patient's room, and I'm observing her holding the patient's hands. And I said to the other nurses, you know, what's going on? Why is she in there so long? Because we've been trying to keep our time in these rooms to a minimum for exposure, and I know that she's a young mother. So I said, why is she in there? You know, what's going on? And they told me that the patient is dying. So, you know, a lot of people are dying alone, and it's, you know, it's very heart-wrenching. But for her to take that time and risk that exposure, holding that gentleman's hand, and you could just see the emotion in her face while it was going on. It was just heart-wrenching, and I give her a lot of credit because that's a very hard thing to do, even for senior nurses. You know, but there's been a lot of young nurses that are really struggling through this, seeing a lot of deaths that we don't usually see, and I really give kudos to her for sticking it out and staying there and holding his hand, and you know, you could really see on her face what her heart was feeling.